Thank you very much, Chairman Stark, Ranking Member Herger, and distinguished members of the committee and staff. My name is Charles Jarvis, and I am the Vice Chair of the Electronic Health Record Association. I'm also employed as Vice President, Healthcare Services and Government Relations for NextGen Healthcare based in Horsham, Pennsylvania. The EHRA Association is composed of 44 companies that employ industry experts in the field of HIT with a broad scope of expertise such as medical and clinical informaticists, physicians, nurses, pharmacists, and technology and policy experts. These individuals not only represent the EHR software industry, but also interact with and reflect the breadth of the entire healthcare community, such as my colleagues up here. I will start my comments by saying that as a representative of the HIT provider community, we congratulate the Center for Medicare and Medicaid Services and the Office of the National Coordinator on their outstanding work in carrying out one of the regulatory requirements of high-tech. We also want to emphasize that we understand very clearly our responsibility to ensure the taxpayer funds allocated to this program are used prudently and effectively. We are committed to getting this right, working with our clients, such as the gentleman to my right, to identify opportunities to achieve the desired improvements in healthcare quality and efficiency. We are also pleased that from the interpretation of the regulation, CMS took very seriously the more than 2,000 comments that were offered to strengthen the EHR incentive program and provide strong incentives for hospitals and individual healthcare professionals to adopt certified EHR technology. Overall, we feel, as do many of our clients, that although ambitious in some regards, the final rule represents achievable goals and it will definitely advance the nation on our road to improved efficiencies. Having said this, the objective to become meaningful users of certified EHR technology does remain very challenging. We do concur with the comment made by Dr. David Blumenthal and now Dr. Hessling that while the program is ambitious, it is achievable. To be responsive to questions that were posed to us, I will begin by responding to the initial question, is the vendor community ready to accept the challenge of supporting clients in their quest to achieve meaningful use? The answer is yes, with qualifications. We have participated in every available forum to learn and offer comments and suggestions and react to the development of the regulations as they were initially released by the HIT Policy Committee and eventually moved to final regulations by CMS. As I said before, we take our role in this process very seriously, and as a result of that, with stimulus funding, these important safety and quality improvements can be extended to the majority of our nation's healthcare providers. We therefore strive to create partnerships among the provider community, the federal and state governments, and the health IT supplier community represented by our association. You also asked us to comment on what portions of the HITECH Act may not work for vendors or medical providers. The biggest factors are the short time between final regulations and when providers are expected to be able to start meaningful use, the lack of a definitive roadmap for future meaningful use criteria, stages 2 and 3, and the associated certification criteria and standards for those stages, and the fact that the final rule does not, in our respectful opinion, fully leverage the work that has already been done in the areas of standards and interoperability. You have also asked us about the perspective of our provider clients. Candidly, there is still skepticism in the market. Many of our clients continue to question whether the stimulus money is real and whether they can realistically achieve meaningful use. The release of the final regulations and the directness of comments made at the HHS press conference last week and your committee work today will help to dispel some of this doubt, as will the actual incentive payments that are coming out early next year. However, we believe that only a concerted educational effort, which we are committed to participate in, and the commitment of resources from all parties involved will allay the remaining uncertainty as to the sustainability of this program as we move into the implementation of the Patient Protection and Affordable Care Act. Please allow me to add several recommendations from lessons learned in our industry that we hope will be considered in the future by CMS and ONC. Number one, provide HIT vendors and medical providers more time to react to the final Stage 2 and Stage 3 regulations. Our position and the position of most of our provider clients, based on careful balancing of multiple factors, is that the final rules for meaningful use and certification should be available a full 18 months before the next stage of meaningful use commences to ensure optimal software development, quality assurance testing, and safe implementation by providers. Number two, depending on the degree of change between stages, the certification rules and process require all hospitals and medical practices to take a significant system upgrade every 2 years, regardless of whether they are moving to a new stage or not. As CMS and ONC prepare for Stage 2, we ask that they consider adjusting certification policies to address this concern. And third, the work on interoperability standards, originally set in motion by ONC and carried on by many stakeholders, needs to be established much more stringently. We continue to encourage regulators to consider the work and specify vetted, proven standards in Stage 2 that we have already participated on. The EHRA is supportive of moving in these standards in the coming years. I wrap up my comments by reiterating my earlier point that we are ready to support our clients, hospitals, physicians, and other healthcare providers in achieving meaningful use based on the solid progress of EHR adoption over the past several years. Thank you.